It's another day in the battle with this pandemic, and unfortunately, the news is bad here in Mississippi. We are on pace per capita to overtake even Florida as the hottest of the hotspots. Currently, we're #2 in the country in per capita cases, and in our local area, in the Hattiesburg hospital referral area, we rank 35th in that small little area in the entire nation, with many of the other hot spots that are ranked ahead of us also in Mississippi. So we are on a bad course, and I think it's time for us as a group to analyze what we've done thus far, what's worked and what hasn't worked, and it is time to take a step in another direction, because we are going to be along the path of where New York City was, where Milan was, if not worse, because we're going into that season with cold and flu right around the corner, and the potential for schools and sports and all these other things to reopen. This could be the world's worst spot in the entire planet. The only thing we can do now, in my opinion, is a major public health intervention. And these are big things. These are mandatory mask laws, which could by itself save us. And that's a big if, but I have hope, and I have confidence in the evidence I've seen in the efficacy of masks, that in and of itself could transition us to safety. Probably what we're going to need to do is have some semblance of another more surgical lockdown, where we give a chance for the case numbers to decline, such that we can go about the previous strategy, which is essentially a whack-a-mole strategy of finding people that are infected, contact tracing them, and then quarantining them more surgically. But we have to make a big intervention. It is not realistic to think that a major medical breakthrough will save us from this. That's essentially magical thinking at this point, and we need to make more concrete decisions if we're going to get to any semblance of normalcy, be able to start schools with any amount of safety, which at this point I have zero confidence that we're able to do. Gravely. I can't emphasize this more. I am very concerned about the prospect of opening schools in the face of the worsening pandemic, with Mississippi being as stressed as we are right now with the resources that we have available. This could be disastrous, and we literally could be the world's worst case scenario. There's something that everyone can do, and quite simply, it's to wear your mask. Please wear your mask. Please ask others to wear their mask if they're not. Please do this, and then we have a chance. We maybe have a chance of getting out of this without a major public health intervention. But I would just start there. Please wear your mask. Please stop doing things like denying facts, like denying truth. There's ample evidence for this. We need to stop with the misinformation. Up till now, I have been less forceful in what I've said in this regard, but it's time to call a spade and to call truth. Masks work, distancing work. We need to start doing that, or we can't open up businesses. We can't go back to any semblance of normalcy. And I just want to be upfront and frank about that, and serious in my tone as I say that. As the Harvard director of the public health department, Ashish Jha, has mentioned that Mississippi's trajectory is to overtake Florida. Florida has, to some degree, stabilized its cases. And, we should just pause for just a second and figure out how we came into this. The states, quite frankly, that are having the most problems are the ones that opened up too quickly and the earliest. And we just need to be cognizant of that. We cannot separate this pandemic from business. If we want to conduct business, which we should and we need to do it with a semblance of precision. And that precision is going to require us to do things safely, do things with masks on. But yeah, to answer your question, I think Mississippi is headed for #1, and this is not a category we want to be #1 in.